Good morning, this is Ed Crowe. Happy Thursday, and happy almost end of AP. I don't know if I'm allowed to say that, but say that I'm happy AP is almost over. But anyway, what we're going to talk about today is I'm going to do a webinar that's a little shorter than most. This one's going to be about 10 minutes. I'm going to go over the difference between Medicare Advantage and Medicare Supplement, and also talk about the positives and negatives of both. This is a 10-minute presentation, so I'm not going to hit all the details, obviously, in 10 minutes. The general idea is to give you a basic understanding of the difference. Obviously, this webinar is going to be more geared towards brand new agents or just somebody in general who doesn't know the difference and wants to, but an experienced agent is going to know most of this stuff. So anyway, here we go. So the agenda, I'll answer the question about which is better, Advantage or Supplement. It's a trick question. We'll talk about Medicare supplements, how they work, positives and negatives, Medicare Advantage, how they work, positives and negatives. And again, the presentation's 10 minutes, so I'm certainly not going to hit all the details, but I think it's a good summary, and it's one for years that I've given clients and brand new agents. So it should work well for you. Okay, so the question is which one is better? And the answer is one isn't better. They're different. They're very different. They both have strengths and weaknesses. And a lot of it really just depends on the person that is looking at it. So if somebody who utilizes a ton of medical care, they might want to look at a supplement. Somebody who maybe wants choice of just going to any doctor pretty much that they want in a number of different states might want to supplement, versus somebody who doesn't utilize much might go Advantage. So it depends. Also depends on the state you're in. Are you in an all-time GI state? Or are you in, which there aren't that many of them, or are you in a state that has underwriting at some point? So it depends. So what we will focus on is a question I can answer for you is what's the difference? And we'll start with Medicare supplements. So a couple things. Medicare supplement and Medigap are the same thing. I hear people get confused about that, but it's the same term, or it's two different terms that mean the same thing. And the key to know with Medicare supplements is that they're secondary to original Medicare. That is really the biggest key to remember. So when you have a med supp, what happens is original Medicare is your primary insurance. So the doctor, the hospital, the lab, testing, anything that is done medically is billed through original Medicare first. What's left over is sent to your supplement. Original Medicare, I say on this presentation, covers 80%. It is an actuarial 80% equivalent on medical coverage. However, it's structured in copays and cost shares, but we'll use 80% for the purposes of this presentation. Medicare supplements also only cover Medicare approved services. That's a big one that comes up sometimes. People think, well, if Medicare didn't approve this, my Medicare supplement will cover it, and it won't in most cases. Medicare supplements only cover things Medicare approves. So again, original Medicare is your primary insurance. So when the doctor says, what am I billing? They're billing Medicare. It doesn't matter who your supplement is. So if a doctor mistakenly says, hey, we don't take Humana, you have a Humana supplement, doesn't matter. Just tell them to bill Medicare. You could have Ed Crowe's supplement. I don't have one, but if I did, I would still work. They're just billing Medicare. Medicare is your network, so to speak. Okay, Medicare supplements don't cover prescription drugs. I was going to just mention that. That's something to remember. You would buy a standalone PDP for that, and they also don't cover dental and vision. As I mentioned, you can buy a standalone PDP. It does not need to be the same company. People think that often. I have to get the same company for the supplement and the drug plan. You don't. They can be two separate companies. Medicare supplements are also standardized. A Plan G, for example, is a Plan G. Doesn't matter which company offers it on the medical benefit side of it. Yes, there may be one company might have silver sneakers and one doesn't, for example, but the medical benefits are going to be the same. So literally from that standpoint, it's a pricing contest. The letter of the supplement determines how much coverage you get. So if you're in a Plan G, everything's going to be covered but your Part B deductible, regardless of whose Plan G it is. If you're in a Plan F, because you were eligible for Medicare prior to 1/1/2020, then everything is going to be covered that's Medicare approved. So, or for example, you maybe go down to a Plan N, and then you'll have a $20 copay. But anyway, they're standardized. So if you're shopping supplements, a Plan N is a Plan N, for example. All right, what are the positives? So, well, the positives with a supplement is you can go anywhere. So there is no network. As long as they accept participate in original Medicare, the provider, you can go. It doesn't matter if they, have never heard of the supplement company or not. Supplements also have very little managed care prior authorizations, meaning somebody wants to get an MRI, a CAT scan, PET scan, they don't have to get prior auth to do it. I mean, original Medicare has very little. You could make the argument that's the problem because of utilization purposes that it has such little, but from a client standpoint, they would see that as a positive in most cases. Continue with our positives. With a supplement, as I mentioned earlier, you can determine the exact amount of coverage. They want everything covered, but they were Medicare eligible after 1/1/20 on 1/1/2020 or after. You can give them a Plan G. It's going to cover everything but the annual Part B deductible. So some plans have very little out of pocket. And also you can match up the drug plan. Maybe your state has 28 drug plans. Well, you can match up the one that covers best for the drugs they take. So what are the negatives? The negatives are there's 3 premiums. So when you have a original Medicare supplement and drug plan, for example, you're paying the Medicare Part B premium, the Med Sup premium, and the Med Sup premium and the Part D premium. So B premium, Med Sup premium, Part D premium. And in most cases, supplements don't have extra benefits, other than there's a bunch of them out there that cover gym memberships, but they usually don't have things like dental, vision, OTC, transportation, things that usually Advantage plans promote and have. The other negative is a standalone PDP often results in higher out-of-pocket costs versus a Medicare Advantage drug plan. That's been the trend the last couple of years. The people who run plans on Connecture, Sunfire, or even Medicare.gov, which you shouldn't be if you are, but if you are, you'll see. Usually the out-of-pocket on the drug Part D portion of the Advantage is coming out better than the standalone PDP. So those are the positives and negatives of the supplement. Medicare Advantage. So the way to think about a Medicare Advantage is think of it as an employer group health plan or an individual health plan. It acts and looks very similar. You have copays when you go to the doctor. It'll have a network. It's similar to a group or individual health plan. Key thing to know is when you enroll in an Advantage plan, the Advantage plan becomes your primary insurance and it replaces original Medicare. Now you still pay for Medicare, you still pay your Part B premium. So somebody says, or if I say, oh, this is a 0 premium plan. Well, it is 0. You're not going to pay a supplement or drug plan premium, but you're still paying your Part B premium. And the other thing is original Medicare is not secondary with an Advantage. The Advantage is your insurance when you enroll in an Advantage. People say, well, do I lose Medicare? No, it's just not your primary insurance. The Advantage plan is, but it's also not your secondary. Remember, you still pay for Part B even with a 0 premium Advantage plan. And the way that works is providers will, instead of billing original Medicare, they will bill your Advantage plan. Advantage plans have the drug benefit built right in. Again, it's similar to a group or individual health plan. So the Part D is built right into the Advantage plan. So what are the positives? Well, many Advantage plans in areas, the competitive plans are 0 premium. So you're paying for Part B, but you're not paying the Med Sup or Part D premium. The drug benefits included. So again, you're not paying for a standalone Part D plan. And obviously now most Advantage plans, and they promote it, they will cover extra benefits such as dental, vision, OTC, grocery cards, depending on, dual plan versus non-dual, energy, flex cards that will cover utilities. There's all kinds of stuff. You should note though, these extra benefits have limits. Like on TV commercials, they say we cover your dental. Well, no, they only cover it up to a certain amount, but that's definitely a positive. So the other positive is you'll be saving every month on an Advantage plan by not paying the Medicare Supplement and Part D premium. There is a catch, however. We'll get to the catch in a second, I guess. I had my slide bullet points a little out of order. But remember, negatives. Since the Advantage plan is primary, it has a network. So that's your insurance. So there's a network. If it's an HMO, well, you can't go out of network unless it's for urgent care or emergencies. If it's a POS or PPO, you can go out of network, but if you do go out of network, it's going to cost you more. So you have to be mindful of the network regardless. Another negative is copays and out-of-pocket cost. So yes, you're saving money by not paying a supplement premium and drug plan premium, but every time you do something on the Advantage plan, you'll pay a copay. Smaller copays for some things, bigger copays for bigger things. And the more copays you pay, the more you're going to be paying out of pocket. So you got to kind of look at I think I talk about that in the next slide. Advantage plans are great if you're not using them a ton, but if you start using them a lot and your copays start adding up, ultimately, in some scenarios, it could wind up costing you more than the supplement premium and the drug plan premium you would have paid on a med supp and drug plan. Other negatives are Advantage plans are managed care plans. So that isn't really a negative, it's just perceived as a negative, but it can make it more difficult. So they have prior authorizations, they manage care versus original Medicare that doesn't. So, somebody wants to get a procedure or something done, the doctor might have to get prior auth on that. Usually isn't a big deal, but they have to, versus original Medicare, they have very little to no prior authorization. So a summary. So for those who don't utilize a lot of medical care, Advantage plans can offer substantial savings because you're saving on the premium, and it might work out. For those who, the math will probably work out in that scenario. For those with high medical care needs, Advantage plans may end up costing more than the Medicare Supplement premium and the drug plan premium. At the end of the day, it's a math equation, and it's kind of a crystal ball effect too. If you're in a zero premium Advantage plan, I use an example here. Let's say you take a zero premium plan and you're using that versus paying $200 a month for a supplement and drug plan. Well, on the zero premium Advantage plan, you're saving $2,400 a year in premium, but it all depends on how much you utilize care and how high your copays go. Also depends on the state you're in. Some states are all-time guaranteed issues, so you can always, every AEP or OEP, you can always switch to a supplement and drug plan. And other states, that's not the scenario. The majority of other states, that is not the scenario. There are exceptions like birthday rules and things like that, but I want to keep my presentation relatively short. Anyway, on the Advantage plan, you could wind up paying more in copays than the premium for the drug plan and the supplement. And it depends on what the out-of-pocket max is on your Advantage plan. In some states, they go up to $8,500, so it depends. So obviously, there's more details to this. I did it really quickly. This is something that if you're an agent, you'd want to discuss with your client. If you're somebody who's potentially going on Medicare watching this video, you'd want to discuss it with your agent to get all the details. I was just using this to try to give you a general understanding of how it works. Hopefully that helped. And I appreciate you coming on today, and I hope everybody has a great day.